Many Jamaicans who are in the diaspora are concerned with returning to Jamaica because of what they perceive to be the healthcare provision that is available on the island. And there are many markers that they use to help them to come to their decisions that they have drawn. And what we want to do in this video is to try and have a conversation about some of these markers and try to make some suggestions or share some ideas surrounding those and how they can impactfully make a difference in ensuring that this isn't prohibiting them from returning to their homeland, Jamaica.
The Jam Fam family. Jam Fam, come hang with me. Yeah.
Hello, Wagwan, big up yourself, whether you're there yard or you're there abroad. Welcome back to another episode of Life with the Jam Fam. In this episode, we're going to be looking at the perceived Jamaica healthcare crisis.
I was able to graduate from school, did my nursing, got my experience in Jamaica and working in the environment in the health sector. Yes, it was hard, but I gave it my best. Patients do come in from all walks of life and I treat them and I never treat them any different. The health sector, it's free. It's free healthcare we have down in Jamaica. And when patients come in, we do take care of them the best that we can. You understand? There wasn't anything like the resources that we have were, oh, this is for the upper class and this is for the lower class. There wasn't anything like that. You know, whatever we have, I can use on everybody across the board. If you have enough money to go and pay for certain things and carrying your little fandangles into the hospital, that's a plus. But it wasn't something that, you know, persons were like, oh, we need to go and get this special thing for this one because this one have better insurance versus this one. In the end, yes, basically that's what it always works out to be. Whoever have more money, you know, you get better treatment. Because if you have more money, you go to one of the top hospitals or the private hospitals in the country. And if you don't have good money, then or insurance, then you go to the public hospital. And the public hospitals, sometimes, you know, they have a little stigma there because, quote unquote, resources always short. Everything down there short. But patients are still coming in and we're taking care of them. Despite seeing the patients in the hospital setting in Jamaica, you know, coming from all walks of life, they come looking dirty. They come looking clean, educated, uneducated. You understand? You have your psych population. All of these persons are mixed into the patients that we see on a regular basis in Jamaica.
Now, to put this into perspective, I just wanted to say that I did contact the Ministry of Health to try and get some information from them. I did also contact the Department of Transport, the Transport Authority, to also get some information from them. However, I have not to date have a response, and therefore at this point I am going to be doing the video without the contribution that I was so looking forward to having to put as part of some of the information that I could present to yourself about these concerns that you in the diaspora are having. Several subscribers have made queries about the road fatalities and the emergency trauma that exists in Jamaica. And I'm going to just look at some of the information that was available up to mid-2024, where the USA road fatalities was 12.8 per 100,000, whereas Jamaica was 18 per 100,000. And we want to look at this and examine this a little bit more because on the face of it, these are just numbers that express a level of severity and we need to get to understand it a little bit further. Although we haven't had any feedback from the Transport Authority, we have a quotation that was taken from the Gleaner from an interview that was done previously. And this is what that quotation says. It says that the practice of some drivers to drive at excessive speeds, to overtake at corners, to drive fast on wet roads, and to drive motorcycles at high speeds without helmets are the main reasons why we are having these fatal collisions. So this was a quote that was given by ACP Macpherson, and this is what he explained in an interview that he had done with the Gleaner. There is also information from the Road Safety Unit which says that excessive speeding and drink driving are some of the factors that have contributed to Jamaica's record of 425 road fatalities in 2023. And although that represented a 13% decrease when compared to the 488 fatalities that were reported for in the corresponding period in 2022. Now, there has also been a decrease in the amount of fatalities that have happened in 2024 as well. There is one other factor that could be giving rise to this high level of fatality in Jamaica when compared to other countries around about it. And this would be the fact that Jamaica does not have a public service ambulance system. There are private ambulance services that are available that people will need to pay to access. However, there is no public ambulance service for the majority of the Jamaican public to be able to use in cases of emergency. And without the necessary or relevant access for people to get from these accident sites to an accident and emergency center, it is more likely that fatalities are going to occur. It is worth noticing or acknowledging that there are many accidents that happens on the roads in Canada, the United States, and the UK, just as accidents are happening on the roads in Jamaica. The difference is that in the UK, in the USA, and in Canada, most of these accidents are not reported by the media other than when they're giving updates on traffic reports for people who are commuting. Most of the accidents that do not result in anyone being injured or roads that need to be blocked off for duration usually do not attract emergency services. They are simply told to report the incident and then refer the report reference over to their insurance companies. Whereas whatever the situation of the accident in Jamaica, you are more likely to hear about it on one of the high points of news, whether on the radio or on the television, and also see footage of it on social media, which sometimes it's quite dishonoring to the people who are in those incidents because they are being showcased on a platform in a way that is dehumanizing and take away from their dignity given the circumstance that they are in when they are being showcased like that by individuals. Now, with every problem and every concern, there needs to be workable solutions. And so, of course, we're going to suggest a solution here. So whether these high numbers are due to limited emergency teams or they are just due to the lack of consciousness by road users, the problem still exists and they need to be addressed. Though people have become accustomed to expecting the government to fix everything, like their foreparents were used to by the colonizers doing just this, we often forget that they were able to use the wealth of the people because of the minimal amount that were paid for their labor. And therefore, they were able to do these repairs or fix these problems in this fashion because people were not actually being paid the money that they deserved to be paid for the work that they were doing. Now, we know that the government have its money that it earns from a range of different places. Some of that includes taxation and other companies in which the government still holds shares or own outright, and also from tourism and other forms of industry that exist on the island. Nevertheless, in countries like the UK, the US, and Canada, and other countries like those, the people within those countries see problems and are actively involved in finding solutions to them as well. This is because these individuals are very conscious of the demands on the government resources and on the funds that government have, and so they seek out alternative solutions. This doesn't mean that the monies need to be coming from people's individual funds, although people can contribute and donate to some of these organizations. But there are many funds that are out there and available that would fund initiative that people need to be more careful of seeing ways in which they can access so that they can address some of the problems that needs addressing within the country. One of the solutions to the fatalities and the trauma and burn victim response is a dedicated emergency response service. This is a service that would have a fleet of ambulance and a devoted team of responders that would work in collaboration with accident and emergency units across the country and a dedicated burns unit in each of the county within the country. Now, these people who would be working in these capacity could be people who are already trained to do things like this in the army, in the police force, or in the fire and rescue department. To realize this, and to reduce the health care worries of people in the diaspora, a Jamaica Diaspora Medical Fund could be set up with the aim to establish an island-wide emergency response service and enough ambulance to be able to set up an efficient fleet to serve the people, thereby reducing some of the fatalities that are happening that would otherwise be averted if there was a fleet of emergency ambulance available to address the emergency demands in the country, whether it be for road accidents or accidents in other aspects of everyday living. Is this something you would consider contributing to if it were to be established? An emergency response team would go a long way to address some of the concerns and issues in terms of healthcare in Jamaica if this was available for people in Jamaica to be able to use. It would also be an attractive point for people in the diaspora who are looking to return to Jamaica when they are aware that if they have an emergency in their homes or on the street, there would be a response team that could come to their aid and provide assistance for them and also take them to medical facilities where they can get further care. Please let us know your views and your opinions about this in the comment below. We're also looking forward to seeing some of the ideas that you have and are happy to suggest. I'm so excited because we're going to be getting our sweet tooth some treat, and it's all courtesy of this lovely fine lady over here. So what are you doing?
I'm making my birthday cake.
Yep. You want to tell us what cake you're making?
Luxury chocolate cake.
Okay. And my princess is growing up. Yes, my princess is growing. Oh. So, are you excited for a new birthday? Are you excited for a new birthday?
Yeah.
Yep, and another one.
I'll feel any different.
Yeah, I think you probably won't feel much different for real. But it's always good to know that you celebrate yourself and that you give thanks for the fact that you've had the opportunity to live another year, and then just foresight and forecast for what you want your next year to be like, isn't it? Because it's so important. So I'm going to let you get your baking done.
Thank you.
And this is the end result of the cake.
The Jam family. Where I living the good life. We're royal, cruising through the West Indies, having fun, enjoying the good life. Jam family, the Jam family, yeah. Jam come hang with me. The Jam family. Where I living the good life. We're royal, cruising through the West Indies, having fun, enjoying the good life. Jam family, the Jam family, yeah. Jam come hang with me. The Jam family. Jam fam, come hang with me. Yeah.
Thank you for staying with us here on this another episode of Life with the Jam Fam. We appreciate you and we appreciate your engagement in the comment section. Bye for now, and we will see you in the next one.